How this ring light works. As usual, I'm not techie, so bear with me. So I think we're gonna go ahead and start. I know people are still joining, but the introduction may take a couple of minutes. So by the time everybody's, in, we should be ready to start, and they should be able to get most of our webinar today. So good afternoon to everybody. Thank you for joining St. Lucia Cancer Society once again for what we promise to be a very educational, interesting, enlightening, and hopefully empowering talk. As we've tried to do, it's not gonna be Dr. Anybody like Dr. Remy, giving information about just any topic. We usually try to get the patient or the personal side to things, because I do believe that testimonials or information coming from individuals usually goes much further than any amount of information that I may be able to give to you. So without further ado, those who've been following our social media pages would know that this month, September, is Childhood Cancer Awareness Month. It's also Cancer Awareness Month for so many other cancers. A lot of the gynecological cancers, the blood cancers, thyroid cancer. And this month we decided to stick to, or to pick, childhood cancer awareness. Last year, we did quite a bit on social media on the blood cancers, and some of it is kind of going to overlap into this webinar. So if everybody hopefully has seen our flyers, you will know that we have 3 guests. I'm trying to multitask while I'm doing this. So what we're going to do is I'm going to introduce each guest as just before they begin speaking. I'm going to allow them to give their own story in the way that they feel most comfortable doing, and maybe interject or maybe ask a couple of questions. And just for some housekeeping, the last time we had a few interruptions with, persons entering unmuted. So I tried to fix that. So we just want persons to just remain unmuted. You can raise your hand if you have a question, or type a question or comment in the chat. I think everybody also has the ability to unmute themselves. So just for the common courtesies, okay? So we're gonna start off with Kurt Augustin, who is a survivor. And interestingly, I met Kurt through one of our other guests, Janita. And since our first encounter, which was really in front of a group of primary schoolers, a small group, that was where I got to hear Kurt's story for the first time. And the rest is kind of history, as people always say. Since then, Kurt has extended his expertise to the Cancer Society. He has also designed, created our website. So I would love everybody to, take a look, support us, and give any feedback that you think may help us with that. So Kurt is a business and IT consultant who amalgamates his experience in innovation, marketing, project management, and technology to develop a very impactful and successful product. He is the founder of a technology company, KPA Technologies, which aims to service the entire Caribbean region with solutions such as IT consultancy, website and application design, internet security, business development through technology, and project management. He holds a bachelor's in IT from UE St. Augustine. He also holds an MBA with specialization in innovation and project management. So without further ado, I'd like to introduce Mr. Kurt Augustin, and also to congratulate him on his new family from St. Lucia Cancer Society. So Kurt, all yours.
Hello, everyone. Thank you, Tamara, for that introduction. I am very, very happy to be here today to share my story. I was a bit reluctant in the past to share my story, because we don't want people to know that we were once vulnerable, and we don't want people to judge us. But I believe my story can influence others and inspire others to do better. So what I will do is tell you a little about my entire experience from a child. Um, Amazingly, I actually remember a lot from 6 years old when my experience started with um, cancer. So I was diagnosed with um, leukemia, acute lymphoblastic leukemia, when I was 6 years old, 5 to 6, that's in kindergarten, going to stage 1. And I must say it was a really eye-opening experience that I have. That experience actually changed my life, the way I see things. I am more inclined to help people. I am always thinking the best in people because I was once helped by many persons, even in St. Lucia, probably persons on this call donated to the cause as well. So let me just tell you a little bit about my experience and how it all started and what happened. And maybe you would be able to understand everything a little more. So at um, 6 years old, I was a very family oriented person. I really enjoy gardening with my father, who was a farmer, commercial farmer. So he farmed cabbage and broccoli and cauliflower, those high end um, crops. And unfortunately, he used to use a lot of pesticides to ensure that the crops they stay or they are of good quality, and that is where I end up getting that leukemia. So a lot of the chemicals that I used in foods can cause you as a child to get that. So I, like I said, very family oriented. We were living with our grandmother. She was taking care of us because we all the family, we were living more or less the same place. My brothers and I can say we were a little bit troublesome, and actually, because we were troublesome, uh, it actually brought out the 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 symptoms, or more or less the signs that I was sick. Because as a kid, you very active. You sometimes, even if you're sick, you still all over the place. So the way we got to find out that I was really sick, my brother Michael Kuhn, they built a small truck with a saltfish box, and they put some tires under the truck, and we used to go inside of it and push each other all around. Now, I pushed that truck, and then it went in a little hole, and then the truck itself hit me on my waist area. And you don't take that for nothing, you're a kid. So I just went about my business, and then I had a bruise on my leg as well. And what happened is that that bruise on my leg, the bleeding didn't stop because the cancer started destroying my white blood cells. I had less platelets and less red blood cells. And that made me more, because my platelets were less, I was more inclined to bleeding more, because your platelets is what stops or clots your blood. So after that, I realized that my whole waist, my entire waist was, and the knock wasn't so intense. It was just, but my entire waist was blue. Like, like some, probably there was dead blood or something, and the bleeding wouldn't stop. And then I realized probably my parents were monitoring me, and I started to urinate blood, and then I had some clots coming out of my mouth, and then my parents realized that something was wrong with me. So all my family members, like I said, aunts, uncles, brothers, sisters, cousins, we all live the same area. So they all monitored me and realized that something was wrong. My dad took me to a person in the community to rub me. You do get those persons that would rub you down, long time ago. So that person told my father that I needed to go to the doctor, and they brought me to St. Jude's. I think I spent a couple of days there under observation, and they realized that I had leukemia. So I stayed at St. Jude's for a few, and then we went to Barbados for the treatment, and I received radiotherapy, I received chemotherapy in Barbados. We spent a good bit of time there. Thankfully for my parents are very amazing. They did everything in their power to ensure I got that support, and they were there by every step of the way. I remember that. I remember my dad. I remember my mom in the room. I remember all of those things. I wasn't in a good situation when it came to my condition. It really hit me hard, where I was in a coma, and I was not eating. I was isolated because you could get any disease because your white blood cells are not functional. And it was a very, very scary experience for me. High fevers. Um, they had to do spinal taps without anesthesia and a lot of stuff like that. So it was an intense experience, and thankfully I remember all of it, and I can share that. My radiotherapy was intense as well, because in that time, that was like a couple of years ago, like probably 20 something years ago, right? So those things just started. So I got the harshest radiotherapy, the harshest chemotherapy. I got burns on my skin. So when the chemo, when they were doing it, and then the needle would come out, or there's a leak, it would burn my skin. Well, obviously the hair falling off, all of that. That's why I'm a bit bald now, because my hair has been thinning for a while. You got skin stretches on your leg, on your arms, so your skin would stretch a lot. So those are the side effects of the chemotherapy. After that, because of my immune system, I still end up getting pneumonia, and I had to go back to Barbados to treat it because it was at a bad state. But like I said, my family, they were really into my entire treatment process. Uncles, aunts, everybody, grandparents, brothers, sisters, everybody, friends. The support was immense. And I think that is an amazing thing, where we have support. So I decided I make it my lifelong duty to support anyone who really needs that assistance, because it really does help, especially when you're multitasking. You have your job, your parent has his or her job, and they have to leave their job and go. And it's a lot. It's a lot for your parents. It's a lot for the donors as well, because, we don't get money anywhere. So I am very thankful that I went through this experience and I could share it with you. And it was an amazing one, and it was a very shaky one as well. But I remember everything. So my gums got, because of the chemotherapy, my gums actually, it shrunk. So they had to extract some teeth, sorry, and then I had to wear braces after, and I had a lot of issues because of the high level of radiation, focusing at school, understanding basic things. I had a little anger issue as well because of the radiation. And I was once told, I may not be a normal person again. But here I am, with degrees and a family. I have a 4-month-old son. I am a happy dad. I have a wife, and I am looking to, even get better in life. But like I say, I firmly believe that we need to pray a lot, because my mom did a lot of that, and my dad did a lot of that. My family members did a lot of that. My brothers did a lot of that. And we need to support each other. We need to donate to worthy causes however we can. It doesn't necessarily mean, money, but a skill, probably one orange could help. Anything can help. Also, I believe we need to share that good experience with other people. So I am very grateful for all what happened, it actually changed me. When I went to this new job that I have right now as a consultant, an IT specialist, I met Janita, and then Janita told me I had leukemia too. So I'm like, wow. So that's when I decided to open up a little about that and share it with everybody, so that we can be aware of what our surrounding is, what we eat, where we go to, and all of those things can actually affect your children. So we need to eat more local foods. We need to eat less chemically induced food. So we have to be very careful what we do and how we do it. But definitely, I am here. I am ready to even share my experience further with more people. My story is way longer than that, but we have a time limit. We need to ensure that everybody gets a chance to speak. So if you have any questions for me, you can always put it in the chat, and then I can see. But that's it for now from my entire experience. Thank you.
Thank you so much, Kurt. Thank you. You know, childhood cancers are not very common in St. Lucia. In general, in the general scheme of things, people don't speak too much about childhood cancers. And I'm so grateful that you, from the beginning, have been so willing and able to share your experience. And what I love most about it, when I heard you speaking to the kids, was that it was done in a very relatable way. And so, yes, we're going to continue to have you as one of our poster people for childhood.
No problem,
cancer.
no problem.
Because just like you said, you know, when we know our kids, we can pick up when something is wrong. They may not complain that it's paining or, you know, the usual things, you know, my arm is hurting me. But if you see a bruise, if you see a bump, something that wasn't there before, and thankfully your parents, you know, did the right thing and got you to medical treatment as soon as possible. And the other thing that I guess we will hear with all three of our guests is that the treatments are usually not available here in St. Lucia. So there's a lot of support that we have to rely on to actually get to treatment. So thanks again, Kurt. I guess anybody has questions, we can probably keep them for after, or like Kurt said, you can direct the questions in the chat and I'm sure that he will be able to answer them. Thank you so much. I just have, I mean, I'll ask the question after, but you can prepare it. Now that you're a new dad, you know, do you have any fears? Do you have any fears specifically with respect to the same thing maybe happening to your child or children, just because you might have had childhood cancer, you know, when you were younger? So you can probably answer that afterwards, but
okay, no problem.
Yeah. Okay.
Okay.
All right. Okay, so we'll move on to our second guest, and I'd like to introduce Janita Pascal. You've heard both myself and Kurt talk about her. So like I mentioned, Janita introduced me to Kurt. She's the founder and managing director of GPA Inc., a coaching and consultancy organization that inspires intellectual innovation. For the past 11 years, Ms. Pascal has served professionally as an administrator and inventory manager. Her career has extended over several industries such as banking, nonprofit, warehousing, and retail. In her final semester, she is an MBA student specializing in leadership and innovation and is certified in many other disciplines that lend themselves to sustainable development and psychological first aid. She has also served as a volunteer for the past 17 years and received the Most Esteemed Volunteer Award from the Department of Youth Development and Sports in 2017. So Janita reached out to me. I didn't reach out to her. She actually found me. We were able to actually sit down and have a chat before all of this COVID. And yeah, she's always willing to volunteer. We haven't quite tapped into her as yet, but we will. So without any further ado, welcome, Janita.
Hi, welcome. Thank you to Dr. Remy for having me. Also, thank you to the Cancer Society for putting on, or for painting the tongue gold this September, as this event is really what is needed. I heard Kurt's story, and Kurt referenced that before he was not as vulnerable. And I myself was not as vulnerable before, but having met Kurt and speaking and Kurt inspiring me, I inspiring Kurt, I decided and I came upon this quote that I wanted to share with you guys. I'm a survivor. What's your superpower? And this is why I'm here today. I'm opening up a bit, drawing reference to this quote and understanding that it is important to share our story because our story can inspire others. A survivor of it all, I have been paying attention to recent discourse as it relates to childhood cancer and childhood cancer awareness. And in a recent statement, again, going back to what Dr. Remy said, the president of Childhood Cancer International did indicate that there has been increased diagnosis over the past 20 years. And that every 3 minutes, a child succumbs to cancer in some part of the world. He also further stated, and Dr. Remy draw reference again to the challenges as it relates to childhood cancer and childhood cancer awareness. And this lends itself to ongoing discourse and keeping the discussions alive and educating individuals as it relates to signs, the symptoms that we should look for. And I'm so excited that we're doing that here today. And the second challenge again was that of the survival rate. And he stated that survival rates are lower in low and middle income countries. And that can be attributed to our healthcare systems, the lack of adequate care, and maybe cost-effective care, which I can testify to. With at least 8 types of cancer affecting children, let me just let my mom in. The 3 of the most common are leukemia, lymphoma, and brain cancer. And it is very important again for us to pay attention to the red flags, as those red flags can assist us in early detection. When you're asking, what are those red flags? I can attest that my red flags that my mother saw were pale eyes, really me withdrawing, and also continuous fever that would not stop. So this is what brought me to acute lymphocytic leukemia, my mother bringing me in to understand what is really happening to me. And the pediatric ward sent me in for evaluation, and it came back that I was diagnosed with acute lymphocytic leukemia. Acute lymphocytic leukemia, similar to acute lymphoblastic leukemia, is a type of cancer that tends to affect our bone marrow and our blood, as it creates immature blood cells, causing ones to have higher counts of white blood cells and lower counts of red blood cells. Normally at this age, every child is upright, bubbly, and ready to take on the world. And you can hear every parent saying, Janita, get down from here. Or child, I said to come back, and that was not exactly my story. I heard Kurt sharing his story, and to be honest, I can't remember much. But what I can remember is losing my hair at preschool and being bullied because the other kids couldn't understand why did I have hair and why Janita did not have hair. And that was just an introduction of the things to come. Coming from a middle income household, the cost of funding this chemotherapy journey was almost choosing between life and death. But thankfully I had a Nigerian doctor who took really good care of me, Dr. Ibagri, and he had ties in Trinidad and Tobago. And through him, we got into contact with a doctor who decided that he would take my mom and I in. And he also through the government of Trinidad and Tobago and the government of Dominica, we were able to access free healthcare. This is where the story gets interesting. Shortly before heading off to Trinidad and Tobago, I was granted 1 hour to attend my preschool graduation. And at this time, despite the odds, I knew that I wanted to be a nurse. I don't know how I was going to be a nurse, but because I was given a 12-year lease on life, I was told that after my 12-year sentence that I would no longer be in existence. However, life went on. I came over to St. Lucia as I'm Dominican by birth. And after 12 long years, on my 16th birthday, reality hit. And I had this big birthday party with all my friends from secondary school because I knew that I was really living my last days. And I allowed cancer to put that lease on my life. I allowed cancer to create that narrative for the rest of my life. And looking back, my thing is, you should never resort to making any challenge, any circumstance, cancer, your socioeconomic challenges, put a list on your life or set the tone for how you will show up for the rest of your life. Or what legacy or story you leave behind for that matter. For me, this cancer journey is one that can allow one to be greeted with long-term side effects. And my long-term side effects were attributed to spina bifida, which is really a condition that allows for the creation of gaps within the spine. And also, unfortunately, I went through a major depression, and thankfully to Kurt, he was there to hold my hand along the way. And I must say publicly, thank you, Kurt. I know you don't like public thanks, but I'm going to do it today. And after this roller coaster ride, I really thought that, you know what, it is important to have the support of family and friends. But it is also important that those individuals take into consideration their well-being as well. As this morning, not going off the childhood cancer topic, but I opened Facebook and I realized that this healthcare professional was speaking about her COVID-19 experience and how tasking this experience was on her and her well-being. So for me, it is very important that I highlight the need for our caretakers and our healthcare professionals to sort the prerequisite care to ensure that their well-being is intact, even as they show up for us, the patient, or I like to call them the victor. And if you're asking, how can I really tap into those types of services? For me, as the patient or as the victor, I did resort to blaming and shaming myself for my story or my experience. And it is important to remain really non-judgmental and understanding that your story can really just be an opportunity to inspire individuals, and really don't take it as serious as it is, because there is a family around you to support you. And for the caretakers and the mental, the healthcare professional story, it is important that you tap into speaking to this trusted source who can understand and validate what is happening as they show up as your pillar of hope. And even today, you know, I continue to say, find that support system, validate, understand. This COVID-19 period has really been an emotional one for me. Again, sending me not back into a depression, but in a mental state where, you know, you see all of your friends having kids and you can remember that voice in your head saying, you can't have any kids. This is the biggest risk of your life, you know? Or seeing individuals standing in line for COVID-19 care or the vaccination, or being able to receive care on a line, and you're wondering, what if that was me? But it is very important for us to understand that it doesn't matter what the what ifs are. There are going to be people around you to hold you up, and it is important that we remain mentally resilient. To end, really having walked this road, or any such road for that matter, the experiences that you encounter can really put a list on your life like it did for me. However, only we have the power to truly decide what we will allow that list to determine, or whether we will allow that list to determine how we journey on and what we get out of life. And sometimes, again, easier said than done. I tell myself this every day. I run a company which prides itself on inspiration and mental wellness, and still I have to find every day that these types of sources that I can tap into to keep or to hold myself up. To end, I don't want to take up all the time. This year's childhood cancer theme is wrapped around better survival. So just as we leave here, It is important that we continue to raise our voices. I know that there is a powerhouse individual speaking after me. So maybe we can band with her and continue to raise our voices, integrating positive practices and patterns to ensure that we are on a path of growth and renewal, and we can renew our mindset as life and its experiences can pelt rocks at us. But the true beauty lies in taking those rocks and using them to become a diamond in the rough, living behind a story or legacy that can inspire others. Thank you again, Dr. Remy.
Thank you, Janita. Thank you so much for sharing. From what you said, preschool, that's a long time ago. I'm not even going to put you on the spot and ask how many years ago that was. I will not. But I think it's really important that people hear that even though you were a child when you went through all of this, that, you know, a lot of the effects are still long lasting.
Right.
And I think you've chosen the right company with the right taglines, etc., and inspiration to keep yourself going. I wonder if you formed the company primarily to do that for yourself, and having been successful, you can now find ways to inspire other people.
Right.
Yeah. And I'm sure your journey probably involved a lot of what Kurt had to go through, the chemo, the radiation. And amazingly, he remembers almost everything. And for you, it's like a blue. But thank you so much for your positivity, and I wish you all the best. You've passed your 12 years post-treatment.
Oh, yes.
And you're still here. You're here with us, and the sky is your limit.
Thank you so much.
Thanks. So any questions, we will ask you. I know we spoke earlier, and I know you kind of alluded to maybe a couple of the things that we could address. So if anybody has any questions, we'll probably deal with them afterwards.
Sure, no problem.
All right, thank you. So our final speaker, and maybe afterwards, I promised that I would not have been doing too much medical stuff. But I think maybe after Melissa, or at some point in time, we can probably just take a look at what leukemia is and what neuroblastomas are in a very basic sense, so that people have an understanding. But I think as you listen to the speakers, you get a sense of perhaps some of the signs and symptoms that as parents, we probably need to look out for. There are a lot more, but signs and symptoms we probably need to look out for with our kids. So I am going to allow Melissa to introduce herself, to introduce Kamar, to introduce Still Standing with Kamar. I'm going to let her take the floor like I've done with the other speakers. So again, without any further ado, Melissa, the floor is yours.
Hello, everyone. Hi, Tamara. Thanks for having me.
Hi.
I just want to say to Kurt and Janita, it was really nice to hear your stories. I haven't heard from any other survivors or any children who are battling cancer at the moment. So it was really nice to hear your stories. I think mine is completely different to what you've both been through, because I'm not the actual person who was battling cancer. However, I am the mother of Kamar, who was diagnosed with stage 4 high-risk neuroblastoma. The survival rate for neuroblastoma is very slim. It's, I think, 1 in 4 children survives neuroblastoma. We're lucky in St. Lucia that, from what I know, there is only 1 other or 2 other children who were diagnosed with neuroblastoma before Kamar. I could be wrong. So I guess my talking points today would be more about what I experienced as a mother with a child battling cancer. I usually don't do the speaking. That's normally my mother's forte for the foundation. But at the age of 1 and a few months, Kamar started showing signs of a very a very low grade fever, but was very persistent, just like Janita's own. because he was so young, we thought that he was teething at the moment in time. And we kept going back to the doctor. Every month we were back in the doctor's office trying to figure out why he had a fever and why we couldn't get it to go away. At that point, I should say, he lived with me. His dad, he was born in the US, but we moved back to St. Lucia when he was about 3 months old. So this started maybe a year after that. His dad lives in the US. So when we got the signs of him being sick, his dad was in the US at the moment in time. So he was here with me and my mother. After going to the doctor multiple times and we couldn't figure out what was wrong, one day he was really sick and I gave him, he's a very active child at that point, I should say. He was a loving child. He played with everyone, with everything. You couldn't stop him from being, he was a typical boy child, you know, very active and jumping off the couches and playing with bugs and dirt and everything that I'm not into. He, with the fever, one morning I gave him his yogurt because he loved yogurt. And he vomited the yogurt. And this was after having a fever for about a week. So we took him to Tapio Hospital to figure out what was wrong. And they said that it was a viral infection, a respiratory infection that he had. So they kept us in the hospital for about a week. And then, not a week, it was a few days. We went home. His dad was in St. Lucia. So he left St. Lucia. And then a few days later, we had a checkup after he left the hospital at the doctor's office. And, you know, as a mother with him for so long, because I spent majority of his time in St. Lucia with him, not working. And I realized that something was really wrong, and I knew it wasn't a respiratory infection. I mean, I'm not a medic, I don't have any medical background, but I knew there was something more serious going on. So I was very persistent with the doctor to figure out what it was that was causing him to be so irritable, no appetite. He always wanted me to lift him up, but he's a very independent child. So that change was strange. So being persistent at the doctor's office, we did a second checkup and they made me undress him. And the minute they undressed him, we saw a bulge in his side. I know I heard it in one of the stories that you, as a parent or as a family, you're watching the children and you're seeing what's going on. But I don't know why it was that we never saw this bulge in Kamal's side. It didn't obviously come overnight, but it was just not something that was visible. So when we saw it, the doctor was like, yes, you need to rush up to Tapio right now. We need to get a scan done. We need to figure out what's going on. So we rushed him up to Tapio and we got a scan, my mother and I. And my mother at the point in time, she knew the technician at the lab because she actually had a brain tumor a few years before. So she looked at him and she said, you know, can you just be honest with me and let me know what's going on? And he was like, Cheryl, it doesn't look good, but you're gonna have to wait to talk to the doctors to figure out what was wrong. So we waited for the doctor, but they admitted us to the hospital that night. He didn't come in the next day, but he called the hospital phone, and I would never forget that because he sounded very distraught, very hurt. And he was like, you know, Melissa, it's definitely a tumor. I can't tell you for sure what type of tumor it is. I can't tell you if it's cancerous or not, but it looks really serious. And Kamal was born in the US, his dad lives in the US, and that is not something that we can treat here in St. Lucia. So you need to get him out of St. Lucia as soon as possible. So I called his dad. Obviously, for two young parents at the time, I was 26, his dad was 26. It was heartbreaking. It was something that I don't think anybody is expecting to hear that from a fever. Your 1 year old is now battling with a tumor that you don't know what his future is going to be. You don't know what your next steps are. You don't know anything that you're supposed to do from that point. So his dad came back to St. Lucia the next day And within 4 days, we have to figure out what our next steps are, what country we're going to. I mean, most children in St. Lucia are diagnosed with cancer. I heard both I think Kurt went to Barbados and Janita said Trinidad. But what I've heard is most children do get help through Martinique. But I don't speak any French and I don't speak any Creole, so I was not comfortable with going over to Martinique because I couldn't understand what was happening with my baby. So I needed to know what we would do. So his dad came home, and it was the support from everyone at that point in time was amazing. We had a huge decision to make and we didn't know which direction to go in. And Kamar was very quiet. He was clingy to me. He always wanted to be lifted up. It was hard. It was emotional for us, but then we have to be strong for him because you don't want him to be sad. So I think Dr. Tanya Boubret, Dr. Bubbles, helped us out and told us, you need to pick a state in the US that he's going to have the most support. And his dad lived in Florida, so we decided that we would go to Florida. But then we had to break down and figure out which hospital we were going to go to, and we didn't know what to do. His dad was the one who got in touch with Joe DiMaggio Hospital in Florida, and they asked him to bring Kamal up to Florida and have his scans done there. Because I should say that his scans done in St. Lucia were not done with contrast. So they weren't able to see the extent of the tumor or the cancer in his body at the point in time. So we got our scans checked. I think my mother was close to Ronnie Goddard, who is another lab technician. And he checked the scans, and he apparently has experience with internationally looking at scans of children with cancer. So he gave us the best diagnosis that we could at the point in time. And he said that from what he could see, it looks like neuroblastoma, and it looks like it's a very serious case, and we do need to get him out of the country immediately. I think the one day I should talk about was the day that he gave that information that it was cancerous. I remember sitting in the living room with Kama, and my mother came in and she got the call from Ronnie, and he was telling her, and it's like the energy in the room changed. You could immediately feel like something was wrong. Although I could not hear the call that she was on, she was just like, oh my God, no, you can't be serious. So she got off the phone and I was like, what's wrong? And she looked at me and she said, it's cancerous. And I remember screaming and crying because I didn't know what I did, what I didn't do, why my son would be experiencing something so serious. And his dad was on the way to St. Lucia and did not know that it was cancerous. And now I have to explain that to him when he gets to St. Lucia to let him know what was happening. So he got here and we discussed that. That was an emotional day for us all, for my entire family, for his entire family. We finally decided on Joe DiMaggio after a few days of debating through different hospitals and decisions from everybody, because everybody was trying to help and we were getting suggestions from everyone. And it was a lot of information to receive at the same time from people all over the world. So we went to Florida to get his treatment done. I unfortunately couldn't go, which is, I think, the hardest time of his treatment process. My mother and his father went to Florida with him and I had to stay in St. Lucia. And through that process, the hospital and my mother and his dad did an amazing job with keeping me informed of what the doctors were saying. I was on, thank God for technology, I was on video call every time the doctors came in to discuss anything about him and his treatment. But they did confirm that it was neuroblastoma, it was stage 4, and he did have to go through multiple sessions of chemotherapy and radiation, and it was going to be an extensive process. I was home for about a month without him. And then when I was able to go up there, I mean, now I had to deal with, you know, my son now, who just left with a full head of hair, now just lost all of his hair. And I remember Janita saying that that was hard for her, getting bullied in school. It was hard for me seeing my son lose all of his hair at that point. I think it hit me that, yeah, he has cancer. And I didn't know what to do with that information. So we got the treatment started. I think my story could be very long, so I'm not gonna go into the whole process of his treatment. But he did lose his battle after fighting for 8 months. And he fought very hard and very strong. He was very brave. He laughed and smiled throughout his entire process. Up until his last day, he was laughing and smiling, not as much as every other day, but he was. So now we have started a foundation in his honor. And you can follow it on the social media pages. We have on Instagram, Facebook, and Twitter that you can join in and see any other information that you want. We try very hard to help any children here in St. Lucia to raise awareness of pediatric cancer. So I'm happy that Dr. Tamara brought me in to speak about it. It's really nice to get the information out there and hear everybody else's story. If there's any questions for me, I'm happy to answer. But you can reach out to me another time as well. If you have any information on any children who are suffering, we're willing to share and help out wherever we can as well.
Thank you, Melissa.
You're welcome.
Thank you so much. So I'm gonna allow any questions. Like I mentioned before, everybody can, you know, raise their hands. All of these stories, I'm a mother, so I'm not sure what I would be doing. And your grace and your poise, as you say, all of that, I'm almost sure it has taken you the 4 years to be able to relate this story calmly. So thank you so much for sharing. And I noticed on your social media page that you did have some interviews, and I purposely didn't even look at those. So I'm hearing your story for the first time today. And I think it's a story that, yes, you need to share. I know you were already doing that. And yes, you're staying very strong. And it's again, something that we don't speak very much about. It's almost when we speak about cancers, we speak about adults. And you know, your story is a little, is very unfortunate, if I can say that. There's a lot to be learned, I think, across the board. For those of us who are physicians, you know, for parents, the knowing when something is wrong with your child, the ability to be able to get your child the help that they need when they need it. So
definitely.
And I think one of the things that strikes me or struck me when you spoke was one of the first questions as a mother, as a parent, is what did I do? And I'm sure in all of your reading that the first thing that you see with childhood cancers is that there's nothing you did. There's absolutely nothing that you did. And you know, all of the questions. So, you know, and like you said, you lifted up the shirt and you saw a bump. A bump, and that is probably one of the more common things. So we try to advise parents, and especially, you know, this was kind of fitting September, people going back to school. It's, you know, the time to kind of pay attention, the beginning of the school year. We should be doing it every year, every day, but just to pay attention to little things. You know, we bathe our kids and we dress them up and stuff, just the little things that we as parents, we're the only ones who might be able to pick those things.
Definitely. I think now, after experiencing that with every other child in my life, my godchildren, my nieces and nephews, I'm very cautious. If I'm giving them a bath or something, I'm always checking everybody's stomach to see if I see anything now, or their legs everywhere, just to see if I see anything that looks strange.
Exactly. So thanks for sharing. I see that somebody
no problem.
asked the question, how prevalent, and I know you asked me the same question, in terms of the figures in St. Lucia. So I'm just going to share, I shared it with you, but I'm going to share it
Yes.
with everyone that, as we stated, it's not very common. I think from some of the data, and I've gotten some rough data, both from pediatricians and, you know, from statistics, that over the last 15 years, we've probably seen a total of 24 cases of pediatric cancers. Of course, you know, give or take a couple who might be diagnosed and fly out. Well, most of the cases here actually have to go away. And as you alluded to, our neighbors, Martinique, Trinidad, and I think most of the pediatricians have a contact with sick kids in Canada where we can actually refer patients. So it's certainly not a type of cancer that we treat here in St. Lucia. And as Kurt and Janita revealed to us, leukemia is the ALL is the most common. And I think Kamal's own is probably third common, the second being a different type of leukemia, AML, and then the neuroblastomas, based on the data that we have. And like you very correctly said, we only have maybe 2 or 3 cases within that 15-year period of time. So it's really not that common. So it's not something that we can, you know, tell people. We still want to say, look out for those things, but it's certainly not that common. And everybody's experience is going to be so different dealing with it. So I don't know if anybody has any questions, if there's anything different that you'd like to say, or any of our speakers, our guests, that you'd like to share or, you know, address. I think with Kurt, I had asked, you know, you're a new dad. So what are your, do you have any fears that I guess stem from the fact that you had ALL as a child?
Well, like I said, my experience changed the way I see things a lot, because I think your next day, you're not too sure what it is, what it will be. Case in point, COVID, nobody ever thought that they would be home on a Sunday. So I think being resilient and being strong, no matter what the situation is, I think it's what's key. So that's what I'm training myself, because if he does, unfortunately, if he, God forbid, I will ensure that I put my first foot down, just like Melissa did, to ensure that he gets the best care. But like I said, with this support, with the 77 persons that logged in on this video right here, we already have that type of support. So my fear level is a bit less, knowing that that support exists. In my time, my parents told me the support wasn't a lot yet because it wasn't something common. So they had to figure out where to go, what to do, which doctor to see, and that might have been the problem, and then flying there, where to stay. But now we're connected through media. We should make the best use of it moving forward and continue to support each other. So if something happens, if you think something is strange, always, you know, you can use the website, send a little message, and we will get it. You can contact anybody, the foundation. You can also contact them as well. So that's really important. And I think moving forward, that's what I will be doing. Use the support and then make sure that I'm resilient enough to handle what comes my way.
Thank you. So I don't see any questions per se in the group. What I'm going to do, if you would just, you know, allow me for 2 seconds, is just to be a doctor for a second. So I'm going to share my screen and maybe just highlight what leukemia is, what neuroblastoma is, just for the benefit of persons who may or may not know. So let me just do that. Again, I'm not very techy. Can y'all see my screen?
Yes, we can.
Oh, okay. I'm not as bad as I think I am. Okay, so again, a nice big pie chart, but it's representing 24 cases that we've seen in the 15 years. This is acute lymphoblastic or lymphocytic leukemia. This is acute myeloblastic myeloid leukemia. And this one, which is the third, is the neuroblastoma. We have different other types of cancers. There's nephroblastoma, which originates from the kidney. And what you'll notice is that a lot of these names have blastoma. So this suggests that these are cells that are forming, and a lot of these changes that make the cells become cancerous actually occur in the fetus. So as you can well imagine, whenever we speak about cancer, we think about things that our bodies and our cells in our bodies have been exposed to for a number of years, just continuous exposure. And for adults, cancers are because of an accumulation of these effects from environmental factors. In a child, though, a lot of these changes happen while the child is becoming or developing from a fetus into a child. So the genetics, the things that happen to the cells are not influenced by what we do a lot of the times. A lot of times it has to do with what has happened during formation. As he alluded to, there may be some associated factors like pesticides, etc. But a lot of times the changes have already started before you were even born. This we've posted on our social media pages. So if we look at this is the bone, and inside of it is the marrow, where cells begin. Not just cells for the bone, but cells that circulate and make up our blood. And there are a lot of different types of cells. When they all differentiate or become their different type of person, this is what makes up our blood. So these are the big names for all the different types of cells. So you see lymphoid, progenitor, meaning mommy cell, right? So these are all the mother cells, and these are the babies that they make. So the type of cancers that you get actually are dependent or named after the cells from which they come. So the types of leukemia, the most common, ALL, as we mentioned, as both Janita and Kurt spoke about, AML, and then the CLL, CML, more common in adults, but we do have adults who get these acute lymphoblastic and acute myeloid leukemias. So on the left, this is what the normal blood would look like. It's a combination of different types of blood cells. You have the red cells, which give the blood the color, and then you have the white cells, which are where the leukemias and lymphomas come from. So this is the kind of distribution we expect to see, where a lot more of the cells are red blood cells, and then the other cells from the white cells, are interspersed. When you have leukemia, you can see the difference. You can see that what you have is almost a takeover of the blood by these big leukemia cells. And because of that, the red cells, which have their own function, the platelets, which help our blood to clot, those are significantly reduced. And that's when we get a lot of the symptoms related to leukemias. So the symptoms that we talk about, fatigue. So children, like Kurt said, or even Janita, up and about, no, they want, and even with Kamar, we want to get picked up, although he didn't have leukemia, but fatigue. Those are common symptoms with childhood cancers, the easy bruising, the fever and chills, the joint or bone pains, the headaches, swollen lymph nodes, which are not very painful, lumps and bumps in the abdomen. And how is that very different from a neuroblastoma? So leukemias are originating from blood cells, whereas neuroblastomas, again, blastoma, cells forming as a child, fetus forms, and originating with nerves. So on this side, what we can see is the spinal cord and all of these places where you can get nerve cells becoming cancers or neuroblastomas. So based on where they're located, they're given different names. So I'm assuming that, and I'm not sure, Melissa can probably correct me, that perhaps Kamar's one might have been a retroperitoneal. I'm not sure, where you could see a bulge in his belly, but you can get them anywhere. Okay,
It's was in his. Okay, I honestly can't remember exactly where it was
okay,
located.
okay, that's fine. That's fine. So these are sometimes how the kids can
Adrenal.
the adrenal. Okay. So if we go back here, right on top of the kidney, you have your adrenal glands, and that is sometimes where you can get a neuroblastoma forming. All right, so there's a kidney in the back and on top of it. Thank you. So signs and symptoms, a lump in the abdomen, a lump in the chest, bone pain. Okay, so just that we can all appreciate what we may want to be looking out for. So if there are no questions, I don't know if any of our guests have any last words, Janita, Kurt, or Melissa, that you'd like to share with us. I think everybody here is extremely appreciative of you speaking, all of you speaking with us and bringing our awareness to this. So again, the floor is open. Feel free if you have any last words.
I just want to say thank you for having me. I did start a foundation in Kamar's memory, so I know we have quite a few people here. If you could just follow the page. We do observe, yesterday was a day that we observed, the 17th of September every year is Paint the Town Gold for Kamar. So we encourage everybody to wear something gold or yellow, since not everybody has something gold to wear. And just post a picture and tag us on the 17th of September every year. Next year is our 5th year anniversary. So we're hoping to do something big depending on what COVID allows us to do at that point in time. So I just like everybody to participate and show some love to the page.
We will continue to do so. Janita?
Hi, I would like to say thank you for having us here today so that we can share our stories. Again, I was happy to hear from Melissa from a mother's standpoint, as she continued to inspire all of the mothers across the world who continue to show up for their kids. Maybe through the Cancer Society or through Melissa, who is already creating awareness, we can continue to raise our voices. And my parting words would be, I always go back to that quote, don't allow life challenges to create the narrative for your life. Take that pen, rewrite your story, recreate your story, do what you have to do. That applies to everybody here, whether cancer would have been our story or whatever life challenges that we are now encountering. Thank you so much again.
Thank you. Thanks, Janita. And Kurt?
Okay, I want to thank you for inviting me to attend this session. I'm very grateful to share my story. This is the first time I'm publicly sharing this story. So the Cancer Society did influence in that decision. I just want everybody to ensure that they continue to support each other. I think that is something that is lacking. I think we need to support each other genuinely, not necessarily monetary, but actually being there, supporting persons that are not okay. And it does make a big difference. And I will continue to show my support. If anybody needs my assistance, I will try my best under my busy schedule to ensure I can lend a hand if I can. So also I want to commend Melissa Rivers for starting that foundation and being as strong as she is right now. Your story does influence many. It will help many. Therefore, you will be truly blessed after experiencing that. So I really appreciate your effort in ensuring that persons get support after a loss. So
Thank you.
that is you being very strong. So keep it up and stay positive, everybody, eat properly, and we all should be okay. Thank you.
Thank you once again to all of our speakers. The St. Lucia Cancer Society, we want to encourage all of you, whether you're parents or aunties, grandparents, to let's do our part for childhood cancers. We still, as much as I have pointed out that most times it's nothing we've done that is going to end up with a diagnosis of a childhood cancer in somebody that we know, somebody that we love. There are things that we can do to prevent cancers as our kids get older. So let's encourage them to eat healthy. Let's encourage them to be healthy. Let's encourage them to stay away from the devices, get out of the house and exercise and be active. Let's pay attention. Let's try, I know it's hard to get the right foods for them to eat, the vegetables, the fruits, etc. But we need to do our part. The thing is that if any of us has a child or a family member who develops a childhood cancer, like I keep repeating, it's not our fault. But as they get older, as our kids get older, what they do, what they become, and perhaps a lot of the illnesses that they may avoid is squarely with us. It's really up to us as parents. So we would like to thank you for joining us. We're really trying to do this a little bit more consistently, but we had to do this in September. And thanks again for always being supportive, and thanks again to our guests for sharing and for being with us. So everybody, please stay safe and reach out to us, reach out to St. Lucia Cancer Society. Our website is up and running. Get all the information that you need, all of our activities, subscribe to our newsletter. If not, you can hit Kut, might be able to set up your website for you. And let's still stand with Kamar. I think Melissa posted all the social media handles. Take your picture. I'm in gold. I don't wear gold that often, but this is for Kamar. So thank you once again and have a good weekend.